The United States has a shocking secret. It is the most dangerous developed nation to give birth. The statistics are alarming. The U.S. maternal mortality rate is 33.2 deaths per 100,000 live births. This is dramatically higher than other wealthy nations. In fact, it's more than double the rate of countries like Canada and the United Kingdom. This is a national crisis demanding immediate attention. Many factors contribute to this grim reality. One major issue is inadequate access to healthcare. Many women, especially in rural and low-income communities, struggle to access quality prenatal and postpartum care. This lack of consistent care increases the risk of complications and death during pregnancy and after childbirth. Another contributing factor is the high rate of chronic health conditions among women in the U.S. Conditions like hypertension, diabetes, and obesity can lead to severe pregnancy complications if not adequately managed. Socioeconomic disparities further exacerbate these challenges. Women living in poverty often face multiple barriers to healthcare, including lack of insurance, transportation, and childcare. They may also experience higher rates of chronic stress and exposure to environmental toxins, further jeopardizing their health and pregnancy outcomes. The U.S. maternal mortality crisis is a complex issue with no easy solutions. Within the broader maternal health crisis, a deeply disturbing trend emerges: stark racial disparities. Black women in the U.S. are 3 times more likely to die from pregnancy-related complications than white women. This disparity persists across socioeconomic lines, education levels, and even among women with access to private health insurance. The numbers are impossible to ignore. Black women face a maternal mortality rate of nearly 50 deaths per 100,000 live births. This is a horrifying reality that demands immediate action. While the reasons behind these disparities are complex, systemic racism plays a significant role. Black women are more likely to experience weathering, a process of premature aging and health deterioration due to chronic stress from racism and discrimination. This chronic stress can lead to a higher risk of chronic health conditions, such as hypertension and preeclampsia, which can have devastating consequences during pregnancy. Furthermore, implicit bias in healthcare settings can lead to Black women receiving lower quality care. Studies have shown that Black women are less likely to be listened to by their healthcare providers and more likely to have their pain dismissed. This can result in delayed diagnoses, inadequate treatment, and ultimately, poorer health outcomes. The racial disparities in U.S. maternal mortality are not isolated incidents. They are rooted in a complex web of systemic barriers that disproportionately impact Black women. One of the most significant barriers is inadequate access to quality healthcare, particularly prenatal and postpartum care. Many Black women live in communities with limited access to hospitals, obstetricians, and other essential healthcare providers. Financial barriers, such as lack of insurance or underinsurance, further exacerbate these challenges. Even when Black women have insurance, they may face higher out-of-pocket costs and difficulty finding providers who accept their insurance plans. This limited access to care can have devastating consequences, as it often results in delayed diagnoses, inadequate treatment, and missed opportunities for preventative care. Another critical barrier is the prevalence of pre-existing health conditions among Black women. Due to a complex interplay of factors including genetic predisposition, environmental exposures, and healthcare disparities, Black women are more likely to experience chronic conditions like hypertension, diabetes, and obesity. These conditions can significantly increase the risk of pregnancy complications and maternal mortality if not adequately managed. Addressing the U.S. maternal mortality crisis, particularly the racial disparities, requires a multifaceted approach that tackles both individual and systemic issues. We must start by expanding access to quality, affordable healthcare for all women, regardless of race, ethnicity, or socioeconomic status. This includes ensuring access to comprehensive prenatal and postpartum care, mental health services, and substance use treatment. It is crucial to address implicit bias in healthcare settings and ensure that all women receive culturally competent care. This requires training healthcare providers on implicit bias, promoting diversity in the healthcare workforce, and empowering women to advocate for themselves and their babies. Furthermore, we must invest in community-based programs that address social determinants of health, such as poverty, food insecurity, and lack of transportation. Finally, we must acknowledge that reproductive justice is essential to maternal health. Restricting access to abortion care will disproportionately harm Black women and exacerbate existing health disparities. We must protect access to safe and legal abortion care and ensure that all women have the autonomy to make decisions about their bodies and their reproductive health. The U.S. maternal mortality crisis is a complex and urgent issue that demands immediate action. By addressing systemic racism, expanding access to quality healthcare, and empowering women, we can create a future where all mothers have the opportunity to survive and thrive.